The doctor takes off the patient's oxygen mask, ignoring his desperate pleas, and this is actually part of his treatment plan. But this patient, he's a presidential candidate. During a speech, the man suddenly struggles to breathe. He gets rushed to the hospital, and after running some tests, Dr. House notices something strange. He doesn't have the knee-jerk reflex, which leads him to suspect there's something wrong with the man's brain. So they perform brain surgery, insert a 1-meter-long pillow, and remove a sample of brain tissue. The test results come back showing no brain tumor or bacterial infection, but they do find something unexpected, a fungal parasite. This means the man has AIDS. The man quickly insists that his private life is clean, even wearing a headband when he runs. He thinks it's a misdiagnosis and demands a second round of tests. The doctors put him through a grueling series of tests, and by the end, he's barely hanging on. But he starts laughing because the new test results show no signs of AIDS, and everything else seems normal. But Dr. House tells him not to get too excited. There's definitely a reason behind his collapse. And sure enough, he soon starts having trouble breathing again, his body spasming, and his immune system dropping fast. The doctors immediately run more tests, and this time they find an issue with his left lymph node. Everything points to hairy cell leukemia, but they need to do a spleen biopsy to confirm it. But his condition is getting worse fast, and he's too sick to sign off on the biopsy, so that option's out. Just when everyone's stumped, Dr. House finds out the man's Epstein-Barr virus test came back positive, and suddenly, he knows exactly what's going on. He heads to the man's room, rips out the breathing tube, and the man starts struggling for air. Dr. House then asks if he's ever taken any illegal drugs. The man refuses to admit it, fearing it will ruin his political career. But Dr. House tells him that if he doesn't tell the truth, he's not getting the oxygen back. Facing death, the man finally admits he took benzodiazepines. It turns out the drug reacts with the Epstein-Barr virus, messing up his immune system and making his body unable to produce enough antibodies, exactly like AIDS. Now all it takes is one shot of immune globulin and he'll be fine again.